Why is it so difficult to learn coherence therapy? I can think of three main reasons. First, learning coherence therapy is like having a very advanced course on the molecular structure of ingredients in the kitchen and then having to cook highly specific dishes for a guest without having a recipe book. There's a basic structure to cooking. You have to choose the ingredients, prepare them, assemble them, cook them, and serve them, but the rest is completely up to the cook. Whereas in other approaches, you know you're cooking Italian, Indian, Moroccan, or Mediterranean, and you have access to recipes. So, of course, it's more disorienting at first as you work your way around the kitchen. Secondly, working with the TRP often involves unlearning clinical habits that have been learned in other therapies. It can sometimes take years to identify and transform these ways of doing and thinking. Like, for example, interpretation for people who come from psychodynamic currents, and detachment from protocol and corrective interventions for people who come from CBT paradigms. And finally, we mustn't overlook the fact that working with the TRP can activate the therapist in his or her schemas. About half of the learning curve is due to this. I've seen several people in supervision, for example, react to the loss of expert status and working in the dark, or to the need to be very framing and directive about the process with their patients. It's important to identify and transform these schemas with a TRP professional in order to move forward more freely in skill development. It's important to identify and transform these schemas with a TRP professional to move forward more freely in skill development. So don't hesitate to talk about it with your co-learners and trainers to continue moving towards fluidity, ease, and autonomy with the TRP and coherence therapy. I wish you all the best in your transformations and hope to see you soon.